I'm Gina Delaney and I work on the National RE team alongside Catherine and Aisling and Jackie. And then, of course, we have the wider team around the country, and you'll be hearing from some of those there today. So, yeah, I'm going to start and just give you an update of what is happening in relation to the recovery framework. So as I said, I'm Gina and work alongside Catherine, and the whole purpose of that is just to show that it's the professional experience and the lived service user or family member experience working side by side in true co-production. And I suppose as we evolve and our understanding of recovery evolves, you know, it's the more and more we learn and we grow, the more we understand that none of us fits, you know, truly neatly into one box, that a lot of us, you know, sometimes can fit into 3 boxes or 2 boxes, or, you know, have experience in some ways, which I think is a good thing, you know, that that's where you get the empathy and the understanding. So the framework was led by Michael Ryan, and I think most of you will know Michael. He worked on the RE team since it began in 2012, and so developing the framework was a very natural fit because of all the experience that was gathered through that process. And for it to sit with RE again now, I think is a very natural fit again, that we would lead in the implementation, and it fits, you know, very neatly and naturally with the priorities that we have. So progressing recovery, and that's nationwide and service-wide. So as Angela was saying, you know, there's a lot of excellent initiatives that are going on throughout, you know, 7, 8 and 9 and nationwide. And I suppose the great thing about the learning sets is that we get the opportunity to learn from each other. We're not reinventing the wheel, that we're respecting what has been done in one area, learning from that, sharing with each other, and then moving it into our own area. So, and as Catherine said, you know, don't leave here today without somebody's name and number, you know, because otherwise it's a waste of your time coming down. The whole point is that you're going to take something away with you that you can talk to service users, family members and staff and management about, and get it going in your area. And service-wide then, so that wherever I may enter the mental health services, or wherever I might be working in the mental health services, that I know that recovery is going to be forefront and what I can expect from that interaction. So whether it be CAMHS, general adult or later life, that I know that my experience is going to be one of recovery. Recovery education then, and some examples of how RE is promoting recovery education through the Recovery Principles and Practices workshops. That it's providing time for teams to come together and look at how do we work in a recovery focused way. And the next step on from that, recovery and practice, providing the time for teams to come together and reflect on, well now, how do we really implement that? You know, so what does that look like and how do we do it? And then, of course, there's peer educators around the country. It's 2 or 3 more that have come on stream there in the last month. So, and really it's just about bringing the lived experience into delivering recovery education around the country. Some more priorities then, developing relationships and continued partnerships with our key partners. So, for example, the Office of Mental Health Engagement, and it's great to have the guys here today to give a presentation, and we'll learn more about what's going on there. The College of Psychiatry, just yesterday, we were working alongside the college in their development of a position paper for recovery, and that will obviously be very key in progressing recovery also. With the Mental Health Commission and with the voluntary sector, that we're continuing to build on those relationships. And communications, it's always key when you're doing absolutely anything. If you don't communicate effectively and continuously, well then nobody knows what you're doing or why you're doing it. So as Catherine was saying there, you know, Twitter, and the newsletter, that we're continuing to get the newsletter and information out there through the newsletter and through the website. And as many ways as possible, because we all take in information in different ways, and you might hear the same message 10 times, but until it's relevant to you at that point, you won't hear any of those 10 times until you hear it the 11th time. So then obviously one of our main priorities this year is implementation of the Framework for Recovery. And Angela was holding it up, so here's the Bible again. So it's the Framework for Recovery and the implementation of that. So developing a national plan that the National RE team will be looking after the development of that national plan. We'll be looking after support for supporting areas in developing their own plans around the country. And also the monitoring and the evaluation of that, because you're not going to wait until the end of 2020 to ask how did that go, because then it's too late. You know, you have to make sure that you're checking in throughout the process to see, you know, how is it working, where are the challenges, and what can we do to overcome them, and then evaluate it. You know, so has recovery developed as a result of the framework from 2018 and on to 2020? So to support that then as well, we have 3 guidance documents that will be launched very soon. So we have recovery education, family recovery, and co-production in practice, because I suppose these are 3 anyways of the key areas that you know, just to learn how do we do it, what does it really mean, and what's the best way of going about it. Because sometimes when we say, you know, co-production or recovery for families or recovery education, what does it really mean, and how can we be, you know, truly effective in those areas? So the framework then is from 2018 until 2020, and it's working on 2 main areas, and that is to develop our understanding of recovery and to develop our understanding of what a recovery-oriented service is. And we do that through those 4 principles. So the centrality of the service user lived experience, and that means that if I use the services, that I define and achieve my own recovery. So that's action 1.1, and a way of seeing if that has been achieved is by the services providing peer support. So I've just picked 1 or 2 examples just to show you, because it's a big action plan with 16 actions. So I've just picked literally 1 from each of the 4 areas. So principle number 2 then, co-production of recovery promoting services between all stakeholders. So that means that I identify my own recovery goals. And that can be seen then through the care plan. Principle number 3, organisational commitment. So my experience shapes the design and the delivery of the services. And then that we provide opportunities in the services to do this. And I know mental health engagement will give us an example of how we can do that. And principle 4 then is supporting recovery learning, recovery education and recovery practice. So that I'm supported then to develop my understanding of recovery. And one example of how to do that is to provide reflective practice then for teams, as we talked about. So the role of RE then in implementing, so as you said, is to develop the implementation plan and support the areas around the country to do the same for their own areas. Report then on the progress and the challenges and the barriers. As I said, there's no point in waiting until the end of the 2020 to see what the challenges were. Define then and implement the monitoring and the evaluation strategy. Support reimbursement and payment for service users and family members, and to develop the resources to support areas in implementation plans, so recovery education programs. So there's 16 actions and 25 measures. And as Angela was saying then again, you know, about taking stock, so mapping against what is already being done in your area, because, you know, each area will have certain initiatives that are already being implemented. They're working well, they'd like to be developed more. So everywhere is at various stages. So it's about mapping against what is being done at the minute, taking stock. It will be tracked then through co-production. So a group will just track the progress. And the framework then is going to be included as part of the performance and monitoring process nationally, and then reviewed then at the end of the 3 years. So I suppose that's just the whistle-stop tour of how the implementation process will go, and we'll be keeping you informed throughout the process. So we'll take each opportunity throughout the learning sets and that, just to keep you updated. Just, I suppose, ending on the quote with Gandhi, be the change you wish to see in the world, that through the framework and the implementation of it, that we all have an opportunity to be part of recovery and to advance in recovery in our areas. So thanks very much.